Hello and welcome everyone to the final webinar as part of the Plant Powered Challenge. My name is Emily and I am one of the health coaches that we have in Lifestyle Medicine Department here. And I am so excited for today's topic, which is Beyond Resolutions, Having Strategies for Sustaining Change. So our presenter today is Kris Rich. She is a national board certified health and wellness coach, and as well as a certified personal trainer. She has worked in the health and wellness industry for nearly 20 years and joined the Corewell Health Lifestyle Medicine team as a health coach when our practice doors opened in 2021. Kris has been working as a health coach for the last 8 years and is really passionate about helping people progress towards sustainable, healthy change. So, Kris, I will go ahead and let you take the floor here, and I will be moderating any questions that come through.
Awesome. Thank you so much, Emily. I really
Yeah.
appreciate that. I am going to go ahead and share my screen here as we get started. Okay. All righty. So, yes, Emily, thank you for mentioning that you're going to be kind of monitoring the chat throughout the presentation. I encourage people to put some questions in there if you have any along the way, even some comments to support one another as well. And we might even have a few minutes toward the end of the presentation to address some of those questions. But I feel really honored that I am presenting the final webinar for the 2024 Plant Powered Challenge. You've had some really great presentations so far, everything from navigating food labels to how to feed your kids more plants, learning about your gut health, fasting for health, planetary health, health for our planet, even some healthy cookbook suggestions, and of course, the infamous Dr. Greger talking with us about how to slow the aging process down. It was a ton of information. Today, I'm actually here to discuss human behaviors. It's great that we ourselves have the power to make such a difference in our own health outcomes. All of the information that you've received over the past month is fantastic, but how do we implement it? And more importantly, how do we stick to it? Dr. Arts, she kicked off the Plant Powered Challenge this year with her top 10 reasons to eat more plants presentation. And I'm sure that there was at least one reason that spoke to you, that was very personal and resonated with you. So you took that reason, learned some great strategies over the past month, and started making some changes and began to create some new habits. We've all done this before, right? We've all set a goal, decided that we want to be healthier, and set out to change something. Whether it was in January at the start of a new year or start of a new season, or because we had a special event coming up. We've all been here before. We've seen some results in the past, perhaps hit a plateau or stress got a little out of hand, our schedules got busier, et cetera, and things end up going back to the way they were. For many of us, it's an endless battle, a vicious circle. And no matter how much information we receive and how fired up we get, it still continues to be a battle. How do we make it stop? I wish I could tell you that it's all a quick fix. We're so wired as a society to expect instant gratification. We're impatient. We get frustrated when things don't happen on the timeline that we think that they should. This is where health coaching can be a really helpful tool. The term coach has been used in many different realms. We have sports team coaches, professional coaches, life coaches, fitness center coaches. It can be confusing and hard to realize the difference at times. So I'd like to explain what a health coach is as it pertains to lifestyle medicine at Corewell Health. This diagram appropriately depicts some of what you can expect working with a health coach on our team. We get curious with you. We help you explore your capacity to change, connect with you, meet you where you are without judgment, and help carve a pathway that makes sense for you. You start to learn so much more about yourself and your ability to change. You learn to be more patient with yourself. Give yourself grace when things don't always work out, and celebrate your successes, even the itty bitty tiny ones that you think don't really matter. As a health coach, my role is to partner with you. And that's the key word, partner. You are in charge. I am just alongside you, working with you to help you build a vision of what your best self looks like. Um, what would you feel like, look like, or be like if you were in the best health that you could be? It's different for all of us too. My vision isn't the same as my colleague Emily's vision, or my spouse's vision, or my best friend's vision. And your vision is unique to you. So by working with a coach, you can begin to imagine this vision and take steps to get you there. We can help you take your wellness vision and create a plan that includes small, reasonable, attainable steps that you see progress with over time. You will also build confidence in yourself. Learn to give yourself grace when needed, and be inspired to push yourself a little bit when you get, to help get you where you want to be with your health and well-being. And getting where we want to be with our health is really a journey. It's quite the journey. Um, we may stay on the same path for years, or sometimes change paths depending on what's most important to us at any given time. There's different phases of life that we go through, so our paths definitely can change. But it's important to remember that it's always going to be a journey. It never really ends. So we encourage patients to keep that in mind. Keep in mind that this is behavior change. These aren't like, temporary things that you do, like going on a diet. Diet kind of, to me, it means like it's a temporary period of time that you're eating differently. We like to think of this as behavior change. So, you're not doing these things temporarily to lose weight or to lower your blood pressure. And once you do, you ease up on it, or, revert back to your old habits. Weight loss is an outcome. A lot of people like to think of weight loss, well, my goal is to lose 25 pounds. And it's a measurable goal because, it's an actual number. You can measure your progress with that. But weight loss is an outcome. Your blood pressure is an outcome. Your A1C is an outcome. Your cholesterol is an outcome. These are numbers that occur based on your behaviors each and every day. So as coaches, we help you to create new behaviors that you can sustain. And again, we help you get to that place where you believe in yourself, that that is possible for you to make these changes. We work with you to build this new identity that matches the vision that you have for yourself. You learn to identify with these new behaviors. They become who you are. A behavior change we commit to is one that becomes part of your identity. You can become someone who exercises regularly. I'm an exerciser. I do this on a regular basis. Or someone who eats whole plant foods most of the time. You can become a vegetarian, or, I eat Mediterranean style, or, whatever you identify your eating pattern, that is just part of who you are. You can become the person that you want to be. We need to kind of shift our minds a little bit to understand that this is a journey. These aren't things that are temporary. Oftentimes in lifestyle medicine, we hear patients say, oh, I'm so happy to have joined your program. This program is great. And I like to remind patients when I talk with them that, we'll think of this as this is a partnership. Lifestyle medicine is here to help guide you. We're here to be part of your care team so that you can build in sustainable habits that support your health, that support, whatever your overall goal is. It is, if it's to even reverse type 2 diabetes, for instance, if it's to lower your risk for many chronic diseases, right? Or to get off medications, we're here to partner with you and help you build that vision and help you get to where you want to be on this path. All right, as I mentioned earlier, you've all been making some changes throughout the course of this Plant Power Challenge. Some of the changes may have been actionable changes. Some changes may have just, happened in how you're thinking. There's thinking, that's how we sometimes start to change, is just by thinking about it. So both are equally important. This slide here illustrates what we call the trans-theoretical model, or TTM for short, in the health coaching world. And this was developed back in 1983 by Dr. James Prochaska. The TTM evolved through studies examining the experience of smokers who quit on their own with those who were not ready to quit or required further treatment to help them quit. It was designed to help us understand why some people were capable of quitting on their own. It was determined that people quit smoking if they were actually ready to do so. So thus the trans-theoretical model, the TTM, focused on the decision-making of the individual is a model of intentional change. So the TTM operates on the assumption that people do not change behaviors quickly or decisively. Rather, change in behavior, especially habitual behavior, occurs continuously through a cyclical process. Specific processes of change are particularly important in moving to the next stages of change. So on this slide, you see sort of like a rendering of the trans-theoretical model and these different 5 stages of change. Number 1, the first stage, pre-contemplation. And, it was designed with, tobacco cessation in mind. And oftentimes I've used a smoker as an example through this change model here. So we have pre-contemplation, means we simply don't think that we need to change. Yeah, I'm a smoker, but you know what? I don't, that's fine. I don't need to change. I'm not going to change. And then we have contemplation. Well, maybe means that, maybe you should change, but you aren't totally convinced yet. Or maybe you think, well, I know that smoking isn't good for me, but I'm not there. I'm not ready. And then there's stage 3, preparation. The preparation stage is where we begin to gather resources, set dates. Like if it's a smoker, set a quit date, ask for help, put a plan together, really get these resources in place that are going to help you with the specific behavior that you are working on developing. And then phase 4, action. Action is where we're doing all the things. We're actively engaging in this new behavior, experimenting with strategies, noticing results, and we're feeling really motivated. Things are going really well. Stage 5, maintenance. You believe more in yourself, that this is really possible. This is where we feel confident that we can stay on track or get back on track quickly if we get off track. Maybe we've sustained this behavior for a number of months and it's become part of who we are, part of our identity. Is it possible to move back and forth between these stages? Yes, entirely possible. We may be in the maintenance phase, feeling really, really good about a new behavior. Even take exercise, for example. You've developed an exercise plan and you've been at it for, a good 6 months or so. Things are feeling really great. And then, something happens. We get sick or we go on vacation, or maybe lose a job and we're super stressed, or a super stressful event happens in our life. So we go from maintenance back to contemplation again, or we're in the action phase. People trying to lose weight, for instance, you're in the action phase, you are eating really healthy, you've added a lot of whole plant foods to your dietary patterns. You've reduced stress, you've, implemented more movement, you're doing great, you're losing weight, you hit a plateau. So oftentimes, again, frustration, we get aggravated. It's like, oh, I've tried everything and now this isn't working too. So we revert back to pre-contemplation. And we think we can't ever do this or we can't get it right. And this is why we call behavior change a journey. Once again, it never ends. But over time, you get stronger and better and more confident that you can get back on track quickly and stay on track longer. There's also been some scientific strategies, people who actually study health behavior change and have developed strategies for how we go about making and implementing these changes. So there are actual strategies for preparing for a change. So, we talked about that in the last slide during that preparation phase where you gather some resources, set some dates, you start to prepare to make this change. And there's other strategies that are involved in that. There's strategies for putting that change into action too. And then also for sustaining change. And for today's webinar, I wanted to focus on what health coaching really is and help give you a better understanding of how we can partner with you, but then also focus on sustaining change to help you feel more confident about staying on track with some of the new behaviors that you've started during the Plant Powered Challenge. So these strategies here, the first one, plan for difficult and tempting times. Events, situations, phases of life will make it more difficult to stay on track. Expect it. Identify what we call these risky situations and make a plan to help you stay on course. Stress, fatigue, feelings of being overwhelmed. These are all what we think of as high risk times. And we all get stressed. We all get tired. And so these high risk times, they happen for all of us. So think about what healthy and positive coping skills you use when you feel too stressed or too tired or too busy to keep going with this healthy behavior. Maybe it's simply just pausing, taking a deep breath, or relying on one specific thing you know that you can do in those moments. Examples might include, I'm too busy to exercise. I've got a lot of meetings, or I've got to take kids to practices, or I'm not feeling well, or whatever it is. Well, when you pause and you think about, well, what's something that, I want to still keep practicing this behavior, even though it might not be a full-blown workout. So maybe it's just, doing a plank for 30 seconds to a minute, or, doing some abdominal breathing, some exercises that way that can help relieve a little bit of that stress, but also help you feel like, you know what? Yeah, I'm staying on track with this movement goal that I have, even though it might not look perfect today, even though it's not part of my plan, and I didn't get in my 30-minute workout. Same can go for nutrition. You get stressed. You didn't have time to meal plan. So now you're finding yourself grabbing things last minute because you're hungry and you don't have anything. So maybe in that period of time, you cope with that by, enjoying a really big, tall glass of ice water and maybe making the best decision that you can in that moment with the resources that you have in front of you and allowing yourself a little bit of grace. Well, if it's not the best healthy choice today, I can do better tomorrow. Again, I spoke a little bit about mindset shift earlier on, and that's going to come into play for a lot of these things. You have to kind of think through what different story can you tell yourself if things aren't going exactly the way you want. Number 2 here, we have set realistic expectations. Don't expect perfection. Relapse is the rule, not the exception. So again, giving yourself grace, learn from slips and get back on track as soon as possible. When you can't meet your goal, like I just talked about, try practicing it, even if it's for less time. This change is an ongoing process. And once again, that word journey, it's a journey. So remember too, that it's always quicker and easier to restart than it is to start from scratch. So, again, developing some of those tools that are going to help you get back on track. Think of a time when you fell off track with that healthy behavior. If you guys can all recall right now, something that, recently that you got off track with. How long did it take you to get back on track? And maybe what is something else you could have done a little bit better or a little bit differently to either avoid getting off track or just not staying off track for as long? Another thing that's really important next here is keeping your change skills sharp. Sustained lifestyle change has no finish line. We've already kind of talked about that. It's your new path forward. Maintaining the healthy lifestyle becomes easier, but always requires intention and thoughtfulness. Keep your change skills sharp by one, always progressing, pushing yourself a little bit further as you meet your latest goal. Don't get tired, just keep challenging yourself. And two, apply your change skills to other behaviors. And the skills translate to help you make healthy change in other areas as well. So if you're feeling really comfortable with your workout routine, then how can you apply those skills that you use to another area of health behavior change, like maybe going to bed early? And number three, too, help others who are interested and ready to make healthy change in their life. Guiding others keeps you focused on your own goals, keeps your change skills sharp, and provides inspiration and motivation to go even further on your own change journey. It creates healthier social network around us as well. We want to be around like-minded people, people who support us in these health behavior change, who also have, the same health goals in mind, and just continue to inspire us to become the best version of ourselves with our health that we can be. So think about what other lifestyle areas you would consider, kind of tuning up a little bit once you meet the current goal that you're working on. And lastly here, but definitely not least, celebrate the successes. Healthy lifestyle behaviors bring lots of positive rewards for you and those around you. It's very important to reflect and celebrate all of the good that comes with healthier behaviors. So, research does show too that your own recognition of the rewards and self-reinforcement is the best incentive to keep up with that change. We're all so hard on ourselves. We're so quick to point out what we're not doing well, or when we mess up and just getting down on ourselves. But again, the mindset shift, there's that word again. When we can change that story that we're telling ourselves, then, focus on something that did go well. Focus on one of the strategies that you use to get yourself back on track, even though things were tough that day. Maybe you celebrate by sharing with others what you've achieved. Or, if you're a reward-based type person, buy yourself a new t-shirt or exercise outfit, pair of socks or shoes. Not all celebrations need to involve food. Rewarding yourself with an activity you enjoy is just as gratifying, if not more. Think about the positive results that have come from your healthy change. Stay focused on that. Keep reminding yourself of that. If you have to put sticky notes up, it doesn't matter. Just always have visuals and reminders of how far you have come. And also, remind yourself, how have others benefited from my healthy lifestyle change? And I encourage you, and I can't see the chat right now, but if some of you are putting some comments in the chat, maybe inspire one another. Talk a little bit about what you've been doing over the last month. What webinar really resonated with you, and what changes have you started to make? And maybe some of these strategies that you're learning today can really help inspire you to stay on track, even if things aren't going great that today or any particular day with that particular change. All right, on this slide here, I just threw on a couple resources. If any of you like to read, this slide offers some suggestions on books that are really helpful when we're creating change in our lives. The first book listed here, Atomic Habits, by James Clear. Some of you have probably heard of it before. Many of you may have even read it before. It's one of my absolute favorite books, and I've talked about this in the lifestyle medicine meetup groups that I've hosted in the past. But it's just such a great book because it's super relatable and easy to read, and a lot of really great tips to help you implement some lasting change. Starting off small with changes is really what this author is about. So if you're somebody who gets overwhelmed really easily, I highly recommend this book to learn how even the tiniest little things add up over time. There's an example in the book, earlier on in the book, that talks about this pilot who makes a flight path plan to fly from Los Angeles to New York City. And he's got the whole flight path mapped out. And then before he leaves, he makes a 0.03 or tiny little degree change in the flight path course. And so by just adjusting by 0.03 degrees, rather than leaving from Los Angeles and ending up in New York City, he ended up in Washington, D.C. So that example is supposed to indicate how even the slightest little change way back in Los Angeles, over the course of time that it took to get across the country, he ended up that many more miles away. So there's that much of a change, that big of a change can happen with just a small little step. Nudge is another great book on health behavior change, changing to thrive, using those stages of change that we talked about in the previous slide, by Dr. James Prochaska. So great resources if you're looking for some help and some guidance. And of course, in lifestyle medicine, we're happy as health coaches to work with you on this lifestyle change journey as well. This slide just gives a little bit of information on our health coaching services. We have board certified lifestyle medicine coaches on our team. And in the health coaching world, we are working on codes to make health coaching billable to insurance. And we're almost there. Super excited about that. But for now, Corewell has made it possible and very affordable for patients to engage in health coaching by charging $25 per 30 minutes of coaching. So if you are looking to put a plan together, to have a partner to help you put a plan into action, to develop a wellness vision, please let us know. We would love to work with you. We have openings for new patient appointments at our practice. We're always adding in-person and virtual classes to our registration page as well. So these QR codes here can help you get to our website where you can connect with us. Our phone number is also listed on the slide as well. So if you aren't already a lifestyle medicine patient, I encourage you to call us, set up an appointment with a lifestyle medicine physician. Let us be part of your care team. Like I mentioned earlier, it's a partnership. So, we don't take the place of your primary care or your other specialty doctors, but we can work hand in hand with them to help you develop sustainable lifestyle behavior change that can help you reduce your risk of disease, take less medications, lower your numbers. I mean, all the things that Dr. Arts talked about too in her top 10 reasons why, right? So if you aren't already, I highly encourage you to call our practice and get in touch with us, set up an appointment. We're so grateful all of you have joined this year's Plant Powered Challenge. This webinar and all of the Plant Powered Challenge webinars this year will be sent in one final email this afternoon. So if you've missed a webinar, be sure to go back and watch using the links that are going to be in that email. We'll also be sending out a post-challenge survey, so please take a few minutes to complete this. You'll remain anonymous, and your feedback will help us improve for next year. So, we love to present all this great information again. So let us know what it is you're looking for. You can always refer back to the recipes and nutrition challenges that were sent and continue to use Diet ID, also the weekly challenges, if those were helpful to you. Our office is available as a resource to learn about lifestyle medicine through patient visits, like I mentioned, and many different types of lifestyle medicine and culinary medicine programming. So please do not hesitate to reach out. And with that, I'm going to stop sharing and just wish everybody well on this new endeavor. And yeah, hopefully we'll be working together soon. Thank you and have a great rest of your day.